For those who I haven't met, my name is Sean Barinholtz. I am an anesthesia and an ICU physician at Johns Hopkins. I am an active volunteer at Pikesville Volunteer Fire Company, and I have the honor of serving as Associate Medical Director in CAR 609 with Baltimore County Fire Department. On behalf of Dr. Andy Pollack in the Medical Director's Office, on behalf of the EMS Office of Baltimore County Fire Department, Director Shenning, Captain Stewart, Captain Natz, thank you for what you do every day. Thank you for your dedication to lifelong learning. A big shout out to Ashley Brooks, who's on the line. Ashley is helping us to run the Zoom platform. Ashley also is going to be using the chat function. If you use the chat function in Zoom, Ashley will be sending out a link sometime during this talk, a link for you to click on, and you can enter some basic information, and we can get you your Maryland or your MIMS CEUs. So if you want your MIMS CEUs, keep an eye out on the chat. Ashley will send out a link at some point during this talk. We'll also use the chat function for you to have an opportunity to ask questions and to interact with Dr. Fitzgerald. Feel free to enter any questions that you have along the way. I think that we are going to hold questions until the end. We're not going to answer questions until the end, but while you have it fresh in your mind, feel free to use the chat function to put your questions in there. So tonight we have Dr. Denis Fitzgerald. Dr. Fitzgerald is a board-certified emergency physician and EMS medical director who currently serves as Division Director of Field Operations and Response at the U.S. Department of Health and Human Services. Working with a dedicated team of professionals, Dr. Fitzgerald oversees a group of high-yield programs focusing on support to the department in important areas such as regional and federal partner engagement, weapons of mass destruction, subject matter expertise, and tactical medical support for federal law enforcement. He also served as medical director for the National Counter Narcotics and Terrorism Operational Medical Support Program. Since 2008, Dr. Fitzgerald has served as the U.S. Department of Health and Human Services in a variety of roles. In each role, he has provided medical support to federal law enforcement teams to include training operations, outreach, and medical oversight for law enforcement EMS programs. In furtherance of this work, he helped to establish a Center for Tactical Medicine. Additionally, he has helped to set medical standards and provide guidance for the delivery of clinical care to victims of large-scale disasters and terrorist incidents. From 2004 to 2008, Dr. Fitzgerald served as the Chief Medical Officer for the Protective Medicine Branch within the Federal Protective Service, U.S. Immigration and Customs Enforcement, U.S. Department of Homeland Security. In that capacity, he provided oversight and medical support for the EMS programs of several federal law enforcement agencies. As a certified federal officer, he also maintained skills in training in law enforcement operations. Prior to the time in the federal service, Dr. Fitzgerald served as a full-time clinical capacity as an assistant professor and staff physician at the University of Cincinnati Medical Center ED. The ED is a level 1 trauma center that cares for approximately 100,000 patients annually. During his time there, Dr. Fitzgerald maintained a focus on EMS and public safety community, including services as a local police officer and medical director for the Regional Special Weapons and Tactics Team. Dr. Fitzgerald has received numerous commendations during his service. Dr. Fitzgerald, I know that's a long introduction, but I wanted to share all of that for sure. And thank you so much for being with us and sharing your expertise.
Hey, good evening, everybody. Thank you for having me, and really appreciate that overly generous introduction. Really grateful to be with you guys today. It's right before the eve of September 11th, and I can think of no more fitting community to spend time with on that anniversary. So thank you very much for everything you're doing on behalf of the citizens of Baltimore County, and it's a real privilege to be with you guys tonight. So what I thought we'd do is just kind of go through the presentation that I tried to put together for you, just looking at tactical emergency medical support, which is what I focus a lot of my time on in federal service, and just kind of walk you through kind of what's going on with that, give you a little bit of background on that, and then certainly have time for whatever questions or any other areas that you'd like to talk about that maybe we cover in the talk, or maybe if we don't. So with that, let me get started here. So here's the standard U.S. government disclaimer. So obviously I put the presentation together, so they're my views in the presentation, and don't necessarily represent the views of the U.S. government or the U.S. Department of Health and Human Services where I work. So here's what we're kind of covered down on tonight. So pretty much what I thought we'd do is just talk a little bit about the top 10 trends of TEMS in 2020. And if you can say that a bunch of times, good on you. So what I thought we'd do just by way of structuring that is just kind of do it by like a rule of threes. So we'd give you kind of 3 strategic thoughts, just kind of laying out the landscape for you and what I see the tactical EMS world to look like. 3 on the operational level, just kind of on a program level or things, you know, as you're building a program that you might want to think about. And then three kind of key things on the tactical level. And the things I decided to focus on were things that I felt would hurt you or get you hurt or get someone else hurt if you didn't kind of have them in your mind as the world has gotten really, really complicated place. And then lastly, what talk these days would be complete without at least doing a head nod to COVID-19 and its impact on the TEMS world and what that's meant for us in our day-to-day work. So the approach on the talk is really, you know, certainly for those that are involved in delivery of tactical EMS. You know, I hope this talk is helpful to you and just giving you a perspective on how we approach it on the federal level. But I also recognize that a lot of folks do other contributions to EMS that don't necessarily involve direct support of law enforcement operations. But you know, my feeling is that there's quite a bit in here for you as well, because I think a lot of the key things about TEMS has some implication in today's world for some of the things that you might be doing. So again, I hope there's something in this talk that will resonate for you all as well. So hopefully something in here for everybody that will be a good takeaway and will be an opportunity to talk about and further not only your education, but in the discussion. You know, I always hope to learn things and always do when talking about this type of stuff. So the way I wanted to kind of go through it is, I was going to basically give you a little vignette from my experience, just things that have happened to me. Sometimes it's not always the brightest bulb on the tree that gets things to happen, and sometimes you're better lucky than good. But in everything that happens to you, you learn things. And so what I thought I would do is share a little vignette from my experience, things that have happened to me, and kind of what then I learned from those things to pass on as a thought for you all to consider in the work that you do. So with that, let's kind of kick off with just a broad definition of what TEMS is, just for those that may not be super familiar with it. So pretty much what TEMS is really, and here you see a definition, it's a spectrum of services that really focuses on the health, welfare, and safety of the special operations law enforcement providers. So in a nutshell, it really involves the support to special weapons and tactics teams, SWAT teams, and basically being a medical provider who can serve in that environment to take care of the law enforcement officers, innocent folks affected during different law enforcement operations, and even people who are potentially having done something wrong that may get injured in the course of what happens when an enforcement action occurs. So we're pretty much there to help out with medical provision for everybody affected by critical incidents involving a law enforcement team. So that's the central message of what TEMS is. But in this talk, hopefully you'll see that there's a broadening kind of umbrella of how TEMS has affected a lot of other disciplines, moving out from this core mission definition. So here we go with the first of the kind of the top 10 trends, and the first of the strategic ones. And this is kind of talking about the fundamental mission. So a little vignette I'll leave you with. This picture right here was something that was made by someone who lived very close to my hometown in Massachusetts, where I grew up. And to me, it has always been the essence of why I go out on the missions that I go out on in support of law enforcement. It's all about this person coming back to this little child. And I think if you push a lot of why public safety people do some of the crazy things that public safety people do, it really comes down to this, to making sure that people get back to the people that depend on them and that they care about. And so this picture sits in my living room, and I look at it pretty much every day. I have to see it on the way out the door. So it is for me kind of what brings me back to why I got into this role and why I continue to do the work that I do. And so with that, the fundamental mission in TEMS has really remained the same in many ways. And when I think about what that is, we really kind of use three kind of catchphrases kind of on a regular basis to try to capture what we think are the core elements of the fundamental mission. And the first is to protect the protectors. So folks that go into harm's way on our behalf, we as medics in a TEMS capacity try to be there to provide support for them and take care of them should they become injured. We also serve as what we call the commander's medical conscience. So that is a role whereby medical providers on a team serving with a law enforcement tactical element are there to provide kind of the medical implications for different decisions that are being discussed. So we don't always get to be the final decision makers, which sometimes as a physician, for some is a difficult thing to accept. But in a TEMS mission, medical providers are in a support role. So while we don't necessarily get to make all the decisions about what happens in these events, we try to at least make sure that as a factor in the decision making, we provide kind of that medical piece to be weighed among the different options that a commander is considering in ensuring the best possible outcome for all of the folks that are involved in these instances. And then lastly, this is really kind of another one of the core pillars, which is the delivery of good medicine in bad places. So we always can't pick the places. They typically are not vacation spots that I've been to when I travel. And certainly, in some of the places that we go to do different actions, it's very difficult, austere conditions where you wouldn't necessarily want to find yourself hurt. But the reality is that people do get hurt in those places. And so we try to deliver the best care that we can wherever we find ourselves, and take care of people to get them back to where they get the best possible chance for having a good outcome in a potentially bad situation. And so whether that's a military role, whether that's a civilian law enforcement, whether that's support of other types of public safety providers, we just try to make sure that we get the best outcome possible for them. Okay, let's go on to take a look at our next kind of strategic trend, if you will. And this officer here on the left is a man I never met by the name of Sergeant Ricardo Preston. Sergeant Ricardo Preston was a federal officer who served in the U.S. Park Police. And Sergeant Preston was at the range with folks that I do know and have really come to respect. One day in late 1980s, when he collapsed and died on the range. And basically, at that time, in the late 1980s, there really was no such real concept as medical support in a law enforcement context. And so what happened as a result of his death was that there was no predetermined medical evacuation plan for that day at the range. There was no pre-staged medical equipment available to perform rapid resuscitation. There was no pre-positioned vehicle to ensure safe transport of an officer who got injured during any activities that occurred on the range. There was no dedicated medical provider there. And so in short, there was no system of care in place to ensure that those officers who were involved in operations or training had the best chance to get medical care if they should need it in an expected event. And so Sergeant Preston, a number of good things sprang. Those folks that were there that day as part of the U.S. Park Police committed to making sure that that would not happen again if they could prevent it. And in so doing, launched what ultimately became the program that I'm a part of, which is the training program for the Counter Narcotics and Terrorism Operational Medical Support Program, which is a federal program designed around teaching medical providers how to work with law enforcement teams and ensure that the kind of thing that happened to Sergeant Preston doesn't happen again. And the exercise, the field training exercise that's part of that course is named in his honor as Field Training Exercise Preston. So kind of looking at that, the teaching moment that gave me insight to is that, TEMS, like any other medical program, whether it's EMS or whether it's EMS supporting fire or whether it's EMS supporting some other public safety mission, has some key elements that need to be in place for it to work effectively. And so TEMS is getting progressively more sophisticated in having these basic elements, such as a dedicated medical director, key equipment that is pre-staged and pre-configured to be able to meet the TEMS mission, an essential infrastructure that allows for the safe delivery of a person who's injured from the point of injury all the way through an echeloned approach to care that gets them to definitive care. And the ability to deliver care with experienced providers who are trained in a manner that allows them to use their skills most effectively in an environment that can be challenging and even have threats or other hazards to their safety and the safety of others, but persevere through that environment to deliver the best care possible. And so it's this system that really is the hallmark of a good TEMS program today. And for me, the importance of that is always rooted in the lesson of the tragedy that befell Sergeant Preston back in the late 1980s. Kind of number three is talking about the evolution of a specialty. So as a big trend, TEMS has evolved quite a bit. This person that you see here is a man I admire greatly, Dr. Edward Mel Otten. Some of you may know him. He's a professor at the University of Cincinnati, where I trained. And he, more than anyone else, got me involved in the TEMS mission back many moons ago. And it was his leadership that really inspired me to attend my training during that period of time in my life when I was trying to decide where to go for residency training. And he was really a big reason that I ended up at the University of Cincinnati. And Dr. Otten was one of the first vanguard folks in the establishment of the specialty of emergency medicine. So University of Cincinnati was the first emergency medicine residency. And basically the work of people like Dr. Otten and a number of other folks that were the first generation of emergency medicine physicians were the pioneers that helped evolve the specialty from its roots, taking from the specialty of medicine and the specialty of surgery, and combining that into the delivery of acute care and what that meant. And so he, more than anyone else, not only showed me the path forward for a career working in the TEMS environment, but by his example and his leadership also showed me how to further the specialty of TEMS, much as he did for the specialty of emergency medicine, back when it was first established as a program in 1979. So kind of taking from that, what I learned was that TEMS, like many other specialties, has gone through and continues to evolve through many phases. Early on, much of what TEMS was basically begged, borrowed, or stolen from either military special operations or other paramilitary units that had a need to early deploy medical capabilities in the context of teams going far forward into austere conditions. And so the genesis of TEMS was basically taken from that experience, of which we had majority of the time coming out of Vietnam in the Vietnam era. Over time, folks like Dr. Otten really became the embodiment of the civilian adaptation of the TEMS experience that they learned in the military and in their service in Vietnam. And it was basically their practice of it that basically showed people like me what that could look like and how to adapt those principles to be able to deliver care in the service of others in difficult and dangerous environments. And then I would kind of put myself somewhere in the zone of one of the folks in the red best practices box. That's really was gifted to me in the experience of these folks who've gone before me in paving the way, and try to codify that in some way in the training that we do with the CONTOMS program, and in the training that we do for other medical providers that serve at the U.S. Health and Human Services field operations section, the National Disaster Medical System. All of those folks that go into harm's way to provide medical care during disasters and other events, we try to take things that we've learned from our world and embody that for them so that they can learn those best practices, codify them into protocols, codify them into procedures, codify them into pathways that allow for logistic support of what they're doing and getting the best equipment for them. And hopefully that's my contribution to furthering the field. And then right now there's a whole group of folks much smarter than I am and much more skilled than I am, particularly in the research area, that are doing a lot of the evidence-based work, which is really going to be the hallmark of defining a specialty. And that is getting questions answered that are important to the specialty, that are uniquely, areas of interest for figuring a way to do things in areas that make a difference to the delivery of care in TEMS. So that's kind of where I see kind of TEMS going forward. And so we have a lot of folks right now that are doing really good work and publishing that work.
Best practice, evidence-based.
And so they're really doing a great service to everybody by answering those questions with the benefit of science and rigorous testing. So moving on to just move forward here. Okay, so talking a little bit about now beginning kind of the operational trends that the three of those that we're going to kind of cover down on. So the first one of those is TEMS and the team. And the little vignette that I will share with you kind of to set the stage for that. On the left, you have the Holocaust Museum as it was pictured on June 10th, 2009. And on that day, a perpetrator went into the Holocaust Museum and killed a guard and created a critical incident around that building that was responded to by the U.S. Park Police, who are the jurisdiction authority for many of the national museums downtown in DC. And the person that you see pictured there is he retired as then Major Pat Smith, and he retired as Assistant Chief Pat Smith from the U.S. Park Police. And on that day, he was one of the early responding officers and indeed took command of the scene and vowed that we needed to figure out as an agency in the U.S. Park Police how to approach training all of our folks to be able to handle that type of a situation, because it was the first responding U.S. Park Police officers that needed to address the problem that had occurred there. And he wanted to make sure going forward, if there were any future events, that those Park Police officers had the benefit of being special weapons and tactics, tactical skills. He wanted them to make sure that they had the benefit of medical skills for those that put in making entry into the building. So,
Hey, Dennis, we're really cutting in and out again. I'm so sorry.
I'm sorry too. I'm not sure what more I can do.
I understand. I totally understand. We'll keep picking up.
Sean, can you hear me okay?
Yeah, it's just a bit, it's quite choppy.
Sean, is there a number to call and go in by the phone?
Yeah, let me Let me also, let me stop your video and see if you can go based upon that, okay?
Okay, can you hear me okay?
Yeah, so we stopped your video and
Okay.
let's pick up again and yeah.
Do you want me to, can you hear me okay now? Or do you
Yeah,
want
I
me to
think
try?
it's clear. No,
Is
I
that
think
better?
we were doing, yeah. I think, yeah, wherever you can pick up. I think we were talking about, yeah, certainly that the officer wanted to make sure that future events had responders who were trained.
Okay, great. So pretty much he recognized that the patrol officers in the agency were going to be very likely the first folks to respond to these kind of critical incidents in the future, and he wanted them to be as well trained as possible. What you see on the right is a picture from September 16, 2013, which was 4 years later, which was the incident at the Washington Navy Yard. The Washington Navy Yard was a situation where a contractor entered into the facility and then entered into a secure building and began to basically kill people in that building. And so the U.S. Park Police was again one of the earliest agencies on scene to respond to that event. And what you see in this particular picture is the U.S. Park Police helicopter lowering a basket with a rescue capability onto the roof. And what happened on that roof was really a testament to the vision that Major, then later Assistant Chief Pat Smith had that day from the Holocaust Museum. Because on that roof, a very injured victim who had made it up to the roof but had been shot and was very seriously bleeding from a gunshot wound, a shotgun blast at close range to her shoulder, was saved by the actions of one of the patrol officers who was one of the early people to get into that building. And pretty much that officer, utilized the training that he had received and provided first aid to that injured woman and saved her life. And it was really a reflection of the vision that Major Smith had for what TEMS training could do for the patrol officer. And that woman today comes and speaks fairly regularly to, and I won't say her name, but she comes and speaks fairly regularly to graduating patrol classes for the U.S. Park Police to share her experience on that day and to give them kind of a charge to the class about what is possible for them to do, if they use the skills that they are going to learn. So for me, what that kind of reflects is what we're seeing quite a bit in TEMS today. So at the center of the kind of the concentric circles, we have the TEMS medic who has a particular set of skills, traditionally focused on the delivery of support to SWAT teams. Very much increasingly, you're seeing these skills such as an emphasis on bleeding control, emphasis on rapid transport to definitive care, an emphasis on being able to deliver care safely in threat environments. Those skills are being pushed out and the frontier expanded into the frontline patrol officers in law enforcement agencies now, much as was consistent with Major Smith's vision. You're seeing it now with engagement of fire EMS, who have increasingly found an important role in missions such as active shooter and other events where there's a persistent or potential threat environment in the world we live in. And now, you're even seeing it now with campaigns such as was kind of sponsored in conjunction with the Department of Health and Human Services and the White House regarding, the emphasis on training for the lay public. And there's a vision for using the kind of training that's provided to TEMS medics and stopping the bleed to make that more accessible to the public who, in addition to now being able to do, lay CPR and have AEDs on the wall, there's a vision for having the bleeding control kits with tourniquets and direct pressure supplies available to the public. And so what you're seeing with TEMS is this concept that a lot of the skills that were brought from the battlefield and adapted to the civilian law enforcement environment can now be spread and have a benefit, to all different types of disciplines. And so that's a big trend of how some of the skills that we're learning within the tactical EMS world, have found root in other environments as the problems that the TEMS medic faces as part of being on a SWAT team are increasingly problems and situations that a lot of us are facing in today's world. Moving on to trend 5, which is technology. So what you see there on the left is the Brinks truck that they told me would stop bullets when I first started working on a regional SWAT team back in Ohio. And I will tell you that I've been shot at in the past, but fortunately it was not inside of one of these, because I've since been told that was not quite as effective at stopping the kinds of weapons that we were up against as the vehicle that you see on the right, which is a modern Bearcat, which is what we currently use. And I will tell you that is rated to stop many of those things. So one of the clear trends in many fields, and certainly TEMS is no exception, is the ability to incorporate scientifically based technology to help in the TEMS mission. And that's certainly something that is common to a lot of specialties, but certainly true for TEMS. And if you pivot to kind of look at what those boxes are or buckets are for technology within TEMS, you're really looking at 3 kind of concentric circles that connect somewhere into the TEMS mission. And the first is kind of medical advances. So, there's a number of things that are happening in the world today that are directly benefiting the TEMS world. And a lot of those things have come out of, the military experience. So one of the few good things that comes out of, conflicts and wars that we fight overseas in the military is the advancement of medical care. And, in the wake of, and in many cases during, prior wars, and certainly the wars in Afghanistan and Iraq were no exception, there've been a lot of benefits that have come from medical advances that have been directly applicable to the TEMS world. Some of the ones on the horizon that we're particularly interested in our program is some of the remote medical assessment technology that allows for remote monitoring of vital signs and other parameters on some of our operators, particularly working in some of the far forward overseas capabilities that we deal with. Some of the blood product substitutes, that fixing that issue of the ability to administer blood products earlier by figuring out how to handle the refrigeration issue that's been a stumbling block for rapid administration of blood far forward, and some of the advances in that, some of the advances in ultrasound and point of care testing that has found itself into the mainstream medical community has now been ruggedized and miniaturized to find a role in TEMS. Similarly, in the tactical arena, there's a number of advances that have been really beneficial to TEMS specifically, and one of the things such as that we've used recently on missions has been, with the new or advancing technology around GIS tracking, the ability to have blue force tracking of folks who are forward and being able to monitor their position through a central command post, even portably, has been a huge advance for us in terms of being able to do good accountability, which in all of our operations, both in the tactical world and in the disaster world within Health and Human Services, is always been a critical area. Some of the night vision capability has been critical for adaptation from the tactical side into the medical side, into TEMS. On the outside the box thing, there's a number of things that we've been working with. In particular, the drone technology is hard to ignore, and its adaptations in a number of capacities for TEMS has been something that we're continuing to kind of experiment with. But collectively, one of the things that if you are in the TEMS community that you want to be mindful of is some of these advances and how they can help you with your mission. I will also say that one of the things that we've dealt with in TEMS, but I think more broadly in EMS in general, has been the very strong presence of industry in shaping decision-making. And so many agencies, and ours is no exception, have a very limited budget and we purchase on a very large scale. So when we're trying to figure out what, to equip our national disaster medical teams with, we need to be sure that before we buy a large quantity of those things that are going to stay in the cache for a long period of time, that we do so with the best scientific available information. And one of the things that we've seen, particularly in TEMS, in the wake of the wars in Afghanistan and Iraq, have been a real focused marketing of a lot of these corporate-driven products. And it's just really incumbent upon our folks to do your due diligence and be educated on some of these advances so that you can incorporate the right ones. There's been a number of situations where folks have, purchased the wrong thing and ended up, not having the right tool and not being able to be, able to get the tool that would have better suited their needs because of, just not being as dialed into the literature around some of these products as you might otherwise be. So just kind of a thought there for just general consumption, but this is an important area just to keep abreast of in TEMS as in many other fields. So the final kind of operational thing I'll leave you with is what I call the TEMS mindset. And the story that I'll share with you on that kind of really brings it to a fore to me is when I was working as a resident early in my career in the University of Cincinnati, and we sent a medical student over to talk with a patient that was in the ER with us. And as is the case, they typically are the first folks to go see folks, and we try to pick people that we think are going to be relatively straightforward and not complicated in any way. And so I did the kind of quick look, and I sent the medical student over to see this person. And the medical student came back and was kind of puzzled, and she said, he isn't really talking really super well, and he's not really giving me a good story. And so I was like, okay, I'll go over and see what was going on. And as soon as I did, he pretty much started to get really agitated with, he had the white coat on and all that sort of thing, and he got really, really agitated. And the next thing, I knew we were tumbling on the floor, and he was kind of going ballistic, trying to bite my head. And anyway, the good news story there is that his sister came walking up a few minutes later, and I can still remember her red stiletto heels about 6 inches from my head on the ground as I kind of kept her brother's head from kind of biting around and biting on me. And she was like, yeah, I was just trying to find, one of the doctors to tell him that my brother's off his meds, and he gets really agitated when he sees white coats when that happens. So, for me, that was just a good lesson right there that, having a good situational awareness mindset is important in all aspects of medicine and not just in the TEMS community. But certainly for TEMS, it is one of the things that we emphasize the most about folks that we train because it's one of the hardest things to teach folks as they make the transition from medical care to law enforcement. And what I mean by that, I'll kind of show you here on this diagram. So if you take, I go to lunch quite often with friends of mine who are working law enforcement, obviously, and I really strive to be as situationally aware as them, but I never am. And they are just trained that way from the get-go. And medical providers don't necessarily have that same mindset. Medical providers tend to be folks that want to take care of people and try to, think of the best of folks. And so a little dose of the situational awareness TEMS mindset is a really healthy benefit that will keep you alive, certainly in a TEMS setting. So when we focus on training medics who want to work with TEMS, teams in support of law enforcement, we really drill this point and make sure that they're situation aware, because nothing will get you killed quicker than not seeing it coming. And so that was the lesson I learned early on, and I share that with you all. Not only if you're going to do TEMS, and certainly if you're going to do TEMS, but even if you're not, it's just a really good mindset. It speaks right to the scene safety that is, one of the cardinal rules of, pre-hospital care delivery. But it goes beyond that. And what you see here is kind of a composite of a number of things that I learned in the course of my training. And they call it the color codes of awareness, about where you should be on that spectrum. And pretty much going out the door in the morning, you should be at a minimum in the yellow mode until you find something that seems wrong to you. And then if it goes red, you're ready to go. And you're very rarely in the condition white or the safe condition unless you're sitting pretty much on your couch watching TV. And that mindset has helped me a number of times since that experience many years ago. And I offer that to you as just something to be aware of. And for every place that you go, always know where you are in relation to your nearest safe haven and your closest potential threat. And this is something that, within TEMS, we drill down to, all the time, because it is something that will keep you alive in any field that you do. So now we're going to move on to the technical areas, or the tactical kind of trends that I would offer for you. And so there are three of them, and the first one is excited delirium. And so this is a still footage from an incident that happened here locally in Fairfax County. Some of you may be familiar with it. I became aware of it, and it stands out for me because I was asked to take a look at the case and provide some guidance to one of the local sheriff's departments around how they can, avoid having a similar incident occur at their facility. So very briefly, what happened in this situation is that a young woman, 37 years old, named Natasha McKenna, was basically brought into the Fairfax County Jail and basically started exhibiting a lot of unusual behavior. And consequently, when she was getting ready to be transferred to another facility, became increasingly agitated, increasingly violent in her behavior, and the team that was trying to transfer her became involved in a protracted struggle with her, and there was, in the end, a really tragic outcome where she succumbed to a sudden death situation, and there was really a lot of unfortunate circumstances around how it played out. And really, what came out of it was that she was, very likely suffering from an excited delirium situation. And the reason I've kind of mentioned this particular case, there are a number of them that have occurred, but this particular case has, they were very transparent with a complete record of the Commonwealth Attorney's report and video of what happened that day. And so from the point of view of learning from tragedy and in the hopes of not having something like that happen again to the extent things are preventable, this particular case is worth just studying from a learning perspective as a provider, because missing this kind of a situation with excited delirium is something that is predictably possible to lead to a death. And so it's kind of like, for me as an emergency physician, missing the pulmonary embolus, right? There's a lot of ways that the pulmonary embolus can present, and if you miss it, it can end up progressing to a situation where the person, dies. So recognizing kind of the factors in excited delirium are a really important thing for a TEMS provider who is often called to a situation where there is an incident created by an individual acting out in some way. But it also could be presenting in a number of other ways that, for EMS in general, is just one of those things that you should really know as much as you can about, because it's something that predictably can lead to a bad place. So with regard to excited delirium, obviously we could spend a whole presentation on that, and we can certainly talk more about it, but this is kind of the basic things that I would take away or offer to you to think about, that I certainly learned from studying what happened here and trying to learn from it, so that I could hopefully try to prevent it from happening again. And so the key to it really is the early identification of individuals who present with a real early ability to mount a violent resistance, because they typically can basically get on what has been termed, and I think probably the best explanation of it at all, which is a freight train to sudden death. basically what happens with these folks in summary is that they typically have some sort of pre-existing mental illness that then gets combined with some sort of stimulus, either a drug or an infection that causes their body chemistry to accelerate. And they get into this really hypermetabolic state that leads to, an altered mental status and ultimately causes a cascade of events that leads them to have a sudden cardiac arrest. And once that happens, the survival rate from that is really, really poor. And part of the problem that's buried in the dynamic here that makes it so challenging is that by the way they act, they create the situation that accelerates their potential for death. So they act particularly agitated, and so whether you're an EMS provider or a law enforcement provider, or however you find yourself in this situation, you have to do something to try to calm them down or if necessary, restrain them so that you can provide care. And the problem with that is that has the ability to accelerate a lot of these, this lethal cascade that has started in their body by creating the struggle that ultimately accelerates their death. And so their behavior precipitates a sequence of events that accelerates the bad thing that's going on with them. And that's why this is a really important thing to recognize out of the gate, because the sooner you can recognize it, the sooner you can potentially react in time to try to take it off that train track. So the kind of things that we kind of focus on are in TEMS training is, looking, the HEED is kind of a little mnemonic for, heeding the signs, meaning recognizing that, it starts with H, which is the hypermetabolic condition, and then it involves progression to excited delirium, which is the altered mental status. And, these folks often exhibit some very bizarre behaviors. They may exhibit somewhat superhuman strength and very strange fixations on inanimate objects as the target for a lot of their outbursts. But that then can progress to what's been termed exhaustive mania, which is basically in the struggle that often ensues, these folks get physically more exhausted, they get oxygen deprived, they start to increase their metabolic demand, and then their supply-demand curve shifts, and then that leads to D, which is sudden death. And so for that, what we suggest is the REACT mnemonic, which is pretty much rapid sedation. So if you can get these folks sedated in some capacity, that starts to de-escalate that pathway. But in all cases, recognize that this is a medical emergency and get them emergency care as soon as the situation is safe to do so. Try to assess, what is driving the train here, and to the extent possible, de-escalate that. But in all cases, you're going to need to contain them and transport them, as safely as soon as you can, because once that path starts, it can be very difficult to reverse in a field setting. So that's one of those things that can hurt you, it can hurt them, and it's just really well worth, whether you're in TEMS itself or whether you're in EMS more generally, it's just really an important thing to be aware of. And I would offer that as something that I learned about and have kind of kept in the back of my mind as one of those things, like a PE when I'm doing a clinical shift, that you just don't want to miss if you can, because the outcome can be very bad. Okay, so moving on to the next thing that's kind of the tactical trend that I wanted to kind of offer for you is just the awareness of a lot of the civil unrest that has taken place across the country. And these are photos recently from late May and June when we were supporting the events on the in Washington at the White House lawn. So what you see here is just the really 2-week kind of unfortunate set of circumstances that evolved between folks and law enforcement on the grounds of the White House. And there was a real persistence to it, and there was a real periods of escalation to it. And one of the things you can see there on the right is one of the detonations of some of these fireworks that were thrown. This is the first I've been involved with different types of disturbances like this going back a long time, and I had never really seen this particular thing happen, which is the use of the fireworks, being thrown into the police lines. So there was just a number of things that happened during the course of those events. And it's just something that you need to be mindful of, certainly in the TEMS world, but even as an EMS provider in general. There's a lot of things that we're seeing and that we saw in particularly recent events that are just worth making sure that you're aware of as part of your safety. So things I would leave you with is just, first of all, just being aware of the importance of pre-planning around these type of situations. So if you're asked to respond to one as part of a law enforcement team, or you're asked to be on an EMS standby, having a good plan around your safety measures and kind of your running routes and alternate routes around these events is really important. These events tend to be extraordinarily fluid and subject to change. And one of the things that you want to be really vigilant on is the potential for things to change very, very suddenly in these events. In terms of immediate action drills, one of the things that you want to be sure of, if you're on a tactical team, one of the things that you as a TEMS medic want to make sure that your team is able to do is get people out of harm's way. So as these crowds surge and there's interaction between the law enforcement group and the protest group, you want to be sure that you have a plan for getting people out of harm's way who get hurt. And similarly, you want to have a really clear sense of crowd dynamics and watching for dangerous indicators of transition between what is a crowd and a peaceful demonstration and a more mob mentality, which can lead to the outbreak of violence. And so as a provider, you want to just basically have that stuff worked out in your head when you have the time to do it, because when the time is short, that's not a good time to figure out kind of how to handle some of these problems, and they happen quickly. In terms of equipment, you know, if you're responding to these type of events, make sure that you have some sort of ability to do rapid decontamination of yourself and your partner or your team if you're supporting a team, and that you have protective equipment that can help you stay safe from some of the exposures that result, whether they're, release of chemicals, whether they're, the release of some of these munitions, whatever they are. Just be mindful that those things have an unpredictable path once the wind blows, or once the crowd shifts, or other dynamics that go along with these kind of things. So have the right stuff available to you. And then lastly, there's just a number of things that we've seen in recent civil unrest episodes that are things that I've not seen before in 20 years. And I would just kind of make you aware of them as providers, just so that you can take kind of precautions around them. So I've already mentioned the fireworks, which was the first time I had seen that. Another one has been fire as a weapon. So you see that in the picture to the right there, but that seems to be something that is occurring more frequently now as an epicenter of a structure getting damaged. The other thing that we've been seeing a lot of is lasers. So shining into public safety personnel, law enforcement, whatever, lasering from the crowd has been something that has certainly been a concern and is a very difficult thing to defend against. And then the use of things like bear spray and other kind of homegrown, if you will, chemical irritants that have been deployed, in these type of events. So just things that we have not seen in we've not seen in past events that I've been a part of responding to, that I would just, make you aware of that we've learned about as we've gone through here. So the ninth trend and the final tactical trend I leave you with is the threat of active shooter, which seems to have really impacted our society tremendously and affected all forms of public safety teams, to include TEMS teams. And this is footage from, again, the Washington Navy Yard. So I was involved in responding to that and going into that event. Unfortunately, when I encountered folks, they were already past my ability to help them, but I was fortunately able to provide some care later on in the event as the situation finally got resolved. But the kinds of things that I would kind of make mindful of you is that this is a really persistent and spontaneous threat in our world today. And it's certainly true for TEMS providers who are involved in this. But the reality is that a number of other entities besides TEMS providers will be responding to active shooter because of the way it evolves without notice and abruptly. And so, the statistics are sobering. So, there's been a number of kind of key studies that you can look up. There's one FBI study that kind of profiled all the events from 2000 to 2015. And in that time, they, had discovered that there were, 1,200 people hurt and 518 people killed. And 60% of those events ended prior to law enforcement arrival from a number of reasons. In many of those cases, the ability of EMS to engage was significantly delayed, and that there was really no typical profile that emerged of the type of person that would precipitate the event, whether it was a workplace event, a school violence, a mall shooting, whatever. And in 2018, the trend was not better. That was the most recent statistics release. So 27 shootings that year with 85 people killed and 128 people hurt in events that year. So again, a significant event during the Navy Yard. There was 12 persons lost their lives and 15 were injured that were able to be saved. But regardless of how these events evolve, they're going to get resolved in really one of four ways. There's going to be a direct patrol response. There's going to be a SWAT team response. There's going to be some sort of combination thing like a rescue task force that manages things, or as in some of the cases, the situation is going to end when the shooter takes their own life. And so when you look at what TEMS has to offer, and broadly what can be learned from TEMS, to extrapolate to EMS, probably the biggest thing of the list that you see here is the training piece. Is training our law enforcement officers, as we talked earlier, to be able to provide that frontline care. What you see on the right there is a picture from Virginia Tech, which shows officers from all different backgrounds who saved this student's life. And if you look really closely at it, what you'll see on his upper thigh is an improvised tourniquet. So this student suffered a gunshot wound through his femoral artery, and the rescue stage by these 8 officers from different agencies working together, saved his life. So training pushed out to other folks, I think, is the key probably that TEMS can contribute to solving this problem. But just be mindful that this is a problem that affects us all, and is certainly one of the things on the forefront of TEMS today. And then lastly, what conversation today would be complete without COVID-19? So as a member of the health department for the federal government, is U.S. Health and Human Services, we are all about COVID all the time. And it certainly has affected many things. And one of the things that it has truly affected significantly is the law enforcement community. And so, law enforcement is, a profession that involves, relatively close contact, as many public safety professions do, with the general public. And so we spent a great deal of time providing that bridge between the medical guidance and the law enforcement officers who have a lot of questions around things like, what is the current CDC practice? What is the protocol for social distancing and social isolation and quarantine? How do we do testing? What do the tests mean? All those things have been a very big part and will be an enduring trend for law enforcement going forward. It is an invisible enemy, and that is something that for the average law enforcement officer has been a more challenging situation than a person with a gun standing in front of them. And so helping them through that has been a big piece of what I have done personally, and what many of us have done over the last several months as the COVID pandemic has worked its way through. So I will leave you with that as the final trend kind of that I wanted to cover down on for you. And hopefully that was kind of helpful to you in some way, kind of leveraging what I've learned along the way. Again, never the brightest bulb, but always try to be lucky when I can't be good, and try to pass some of that on to what others have shared with me and what I have picked up along the way to hopefully make your work safer. And again, my thanks to you all here on the eve of 9/11 everything that you're doing on behalf of folks in the county. And with that, I will stop. Sorry again for the little technical issues that we had along the way, but happy to stick around and answer any questions that anybody may have about things we talked about or other things that you would like to talk about. So Sean, back over to you.
Oh my gosh, Dennis, thank you so much. That was outstanding. What an amazing amount of content and experience that you were able to share. Thank you so much. So we are getting a couple of questions. I don't know if you can see the chat. So amazing presentation. Thank you so much. Another thank you. And then there's one that says there's a recent controversy on the use of ketamine in the ED, excited delirium, I assume. Your opinion about that?
Yeah, so that's absolutely right. So there is what I will tell you is, just taking a step back broadly, rapid sedation has been the ideal rapid sedation protocol has been the quest for the Holy Grail. In TEMS certainly, but even more broadly in my emergency practice. We would love to have a situation where we avoid the struggle, right? The struggle is what hurts healthcare providers. The struggle is what hurts patients. The struggle is what hurts police officers. So one of the things that we bring as medical providers to the scene is the ability to use healthcare and medical modalities, chemical restraint, to resolve those kind of situations. The problem is that short of administering a rapid paralytic, which is one form of rapid chemical restraint that I wouldn't recommend as the way to go out of the gate by any means, we don't have a really quick, safe knockdown agent that can take somebody very quickly from a highly agitated state to a more compliant state where medical care can be rendered and the person can be safely transition to a better situation. So, historically, we have used a number of agents to try to achieve that. In much of my training, the kind of go-to pathway was, either a combination of Haldol or Haldol and Versed as the two agents. Droperidol was in vogue as a very quick agent for a while. The problem with both of those agents, both those combinations, is there was an increasing concern around QT prolongation, as well as some delay in their onset. They were not really quick in their action. Even the Versed, which was considered to be the fastest of the benzodiazepines. So, a lot of folks have migrated toward ketamine for a lot of uses, for general, anesthetic purposes, but also, at very high doses in this idea of a rapid takedown drug. There are a couple of concerns with it. So if you read, a lot of the company literature, they recommend against, in many cases, using it for psychologically agitated folks. And so there's that concern. The other concern historically, although I've not seen it in my practice, has been, of course, the potential for the hypersalivation and issues with airway management or the need to do rapid airway management in the wake of it. So I guess the answer I would have to that is there's no perfect agent. I think folks, are looking at, in that situation, the lesser of bad choices. And, you're going to fight this guy. You're going to try to use a chemical agent and risk the consequences of that. Or you're going to use another, control tactic such as a taser and run the risk of, the association between that and, particularly like an excited delirium, outcome. So what is it that you're going to do? And unfortunately, right now, we don't have anything that's a great solution. We just have trade-offs, and ketamine has its trade-offs. I hope that answers your question.
What a great answer. What are the injuries from tasers?
So I think, there's obviously the biggest concern that you can have with a taser is the conditions under which you deploy it. So, you clearly want to watch the fall. So, with the level of the, muscular incapacitation now, folks that it used to be that you could fight through these devices, right? And so a lot of the training, that we use around different law enforcement tools, such as, OC spray was, designed to teach you that you could fight through it, but you can't fight through the modern taser once it gets hold of you. So the biggest, risk to it, honestly, has to do with, uncontrollable falls in the wake of its deployment. And when somebody gets hit, where are they in a safe location, and how are they going to fall? So the second area has always been a kind of this association between tasers and death from excited delirium, and there's been a lot of back and forth on that. I think that where we've come on that is that I don't think that the taser deaths in those situations are directly attributable to the taser. I think that if that were the case, you would see a very sudden, abrupt death from the current itself. I think what you're seeing there is in the multiple applications of tasers in the situations where that's been done, what you're building up is just a rapid acceleration of bad chemicals as a result of that, and those repeated depolarizations from the taser, and that's what puts you on the path, I think, to association between use of taser or any other repetitive technique that involves some sort of restraint or incapacitation of these folks with this excited delirium that accelerates that train ride that they're already on, to a bad place. And it's not that this is, the problem again is by the virtue of the behavior that these conditions cause people to engage in, it creates the problem that accelerates the bad situation that they're in. And it causes others to have to take action, of which again, there's no perfect answer that, unfortunately can accelerate the pathway that they're already on.
Great. Anyone else? Feel free to use the chat to enter your questions. You had mentioned a couple of different advances as well in blood products you had mentioned. Are you guys using antifibrinolytics?
We are, yeah, we are.
Racemic acid or?
Yep. So we're using a number of the products. We pretty much depend a lot on the area that we go in for. Whatever the other, so we've traveled. It's interesting to see because we've traveled in a lot of different parts of the country, and some of these folks have systems in place where when we use them in the field, they can follow on with the system at the hospital. Mm-hmm. We've kind of just been able to just have our what we bring is the first dose, and then we're not really equipped to provide that second dose, so we have had to kind of look at that for our planning purposes going into some of these situations to make sure that we have that second dose, because we don't routinely carry it, for most of the situations that we deploy on.
Mm-hmm. Yeah, it's definitely picking up in the pre-hospital. At least I'm seeing a lot more articles about it for sure.
Yeah, originally several years ago we hardly found it. It was really rare, and now it's becoming much more common to have pre-hospital administration, but then hospital systems, trauma systems that support that, going forward with the follow-on dosing and other things.
Mm-hmm. Dennis, I also know there are a bunch of young providers online with us tonight too, who may be interested in TEMS. Any sense for how to get involved for a young provider interested in TEMS?
Yeah, I mean, I think there's a number of different ways to do it. I think so one of the ways you can certainly do it is by being part of a public safety agency, already. And very often, in days gone by pre 9/11, there was a well-known divide in the cross support of different public safety agencies, and that by and large has really pivoted. And so now very often you have fire and EMS medics supporting law enforcement agencies within their communities as part of a TEMS contingent. So if you were in a public safety agency already, there's very often or very likely a pathway that uses the support provided by fire EMS to assist in law enforcement missions. And that's certainly where I used to work in a number of different areas. That was how they did it, that the EMS agency provided that support. The other pathway is, even if you're, let's say in a law enforcement capacity, very often so one of the agencies that I work with here in Montgomery County, basically trained a program within their law enforcement agency to basically train their law enforcement officers as EMTs, so that they could serve as, TEMS medic within their agency. So they adopted that model where they actually, drew within their agency. And if you're not, if you're not affiliated with any agency full time and you're looking to get into a TEMS role, I think there's a number of things that you need to think about. I think, certainly finding a program, such as some of the medical centers that provide, programs that support their community as a TEMS program is one pathway. Certainly, joining one of the public safety agencies that has an existing program, is another way. But I think, that right now more than ever, because of this kind of cross-pollination between, EMS and law enforcement, mm-hmm. and the growing acceptance of TEMS as a field, there's a lot of different ways to do it. And certainly, outside of that, in my experience, there's certainly opportunities, if you go forward as a physician's assistant or a PA, or a physician, to come into the field and support in that capacity.
Great. Thank you so much. What a great, fascinating topic.
I hope it was helpful. And again, thank you to everybody for taking the time to listen, and be safe in what you're doing.
Thanks, Dennis. Thank you so much for all you're doing to advance that science in the field and protecting our providers. Thank you.
Thank you very much.
A bunch of thank yous rolling in on the chat, and I also know that Ashley sent out a link. If anyone wants CEUs, make sure that you see that link. Maybe Ashley can send that one more time. And I also know that Captain Stewart had something to share.
Yes, Dr. Barinholtz, it's me. Thank you.
Yes, sir.
Dr. Fitzgerald, I just wanted to take a minute to thank you for your time. We really appreciate it. Given this time is exceptional. On behalf of Baltimore County, thank you again. And I want to send a shout out for anybody that's online from a different jurisdiction. If you could please, Ashley has included a field of your primary affiliation. If you could just put that in there, we're going to start reaching out to your representatives in Region 3, try to get this out. You are welcome to join us every second Thursday and fourth Thursday of the month. Dr. Barinholtz has done an excellent job of getting this information out. This is MIMS-based protocol driven for the most part, so it is CEU hours. And we'd really like you to get the word out if you enjoyed it tonight to your partners and your colleagues, and we will be sharing more. Thank you very much for your time.
Thanks, Captain Stewart. Thanks for all your support, as always.
Thank you. Have a good night.
All right, everyone. Thank you so much. We'll hang out if there are any other people who want to sign in to make sure that happens.